More than 40 Army Reserve soldiers from the Arizona-based 74 53rd Medical Battalion traveled to Kimau Medical Center in Hoopa, California to augment medical care for the local Hoopa tribe and surrounding communities. Eva Smith, the medical director of the center, describes the need for the innovative readiness training event her committee requests annually.
You know, we're in a pretty rural site, so it's hard to recruit, let alone retain. And so it gives us a little bit of extra help, and we'll take it when we can get it. It also gives our providers a little bit of a break. You know, every day is pretty fast-paced, and sometimes they just need to take a deep breath, and this offers them. It doesn't always work out that they can take vacation, but even just having a couple days off, a couple providers were able to take a couple days off here and there.
The pharmacy at Kimau is probably the busiest place in the medical center. Pharmacist Kia Lore recognized the work ethic of the Army Reserve Command soldiers that assisted her for a few weeks this summer.
They will come right up and do you need help? So they're very attentive. They respond with urgency, which is something very unique. Wow, they are right on it. And I like that because I'm in the pharmacy and that's what we do. You have to respond with things with urgency.
The Department of Defense's Innovative Readiness Training Mission pair up with training requirements for active Guard and Reserve service members with real-world requirements in local communities. So explains the commander of the Medical Battalion, Colonel Eileen Brown.
This is real-world training, and we're providing no-cost health care to the medical center, and it's pretty much hands-on and using their abilities to function independently or side-by-side with the clinic staff.
Duane Sherman, a patient at the clinic, shared his experience at the event.
Well, I think there was an exceptional level of care. I was seen by a physician's assistant. There was a nurse there. They were able to go in the other room. I saw radiology. I was immediately moved through. I think I did 7 different pictures for radiology or x-rays. I came back out. They were able to fit me with a sling and get me on my way. So I think that's fast, efficient, effective service.
Lieutenant Colonel Randolph Derr, the executive officer for the 74 53rd Medical Battalion, explains in addition to caring for the patients, the unit has assisted in improvements to the medical facility.
So it's been a very interesting mission that they're not afraid to ask for things if they need them. We accommodate them as much as we can, which has been pretty much every time they've asked for something outside the box, we've been able to accommodate it, which has been very nice for us.
Examples of outside-the-box assistance included tapping into a soldier's civilian IT experience to connect a surveillance system for the medical center, while other soldiers organized and coded medical supplies to allow faster retrieval and inventory. An operating room technician adapted his skills to sterilize dental equipment instead of operating room tools. Soldiers also maximized their off-duty time by participating in the community's Sovereign's Day celebration. Floats that soldiers assisted to create made their way through the streets of Hoopa to recognize the tribe's anniversary.
We've been real fortunate to have them come here for more than 10 years, probably. I don't know the exact date. But it's been something that the community's expected, and it's been great.
Reporting from Northern California on the Hoopa Indian Reservation, I'm Sergeant First Class Kenny Scott for Army Reserve Medical Command.